All right, so today's question comes from Trevor Siuk. I hope I say your name right, Trevor. I don't want to ever slay anybody's name. But he asked me in the CPC online question submission form, which is one of the perks of doing the online course, is you can actually ask me direct questions, asked me about functional overreaching and non-functional overreaching. So first thing I want to do, set a baseline here and explain functional overreaching, or what most people think of when they're thinking of a peak. So I've got two graphs here. First one, time going across the bottom, performance going across the top. And what we'll typically see as somebody trains is they hit through their acclimation phase. We start to ramp up performance. We also start to see a ramp up in volume and intensity. And we hit this spot right here, which is one of the highest fatigue points of the training block. And what we want to see after that is super compensation. There we go. Super long word, right? What we need to happen though, because fatigue is high here, and performance we start to see a decrement in, we start to see it go down, is right here, we want to rest. And what that does, the decrease in volume, the decrease in intensity, or the taper allows the athlete to supercompensate, and we see an increase in performance. Another way to look at it is by taking time and load. So in this particular instance, we have time going across the bottom again, and load here, with the dotted line being recovery ability, which is an important thing to kind of conceptualize here. And if you watch kind of as we go through the acclimation phase, we hit this spot where we're overreaching on recovery. We're expending resources that we cannot recover from. And we can do this in a short period of time to stoke supercompensation. However, where non-functional overreaching happens is when this time frame gets extended out and we have a flatter hump here or an even continued increase in acute load. And all of this is now not recovered from. And then what we see on this graph, performance graph, is we start to see a decrease in performance. And this is where this non-functional overreaching starts to occur. We see a decrement in performance that ends up extending through time further. Some people consider it burnout. It's not true overtraining. I find overtraining something to be very difficult to do. But this non-functional overreaching is when we've taken that high intensity, high volume, and we've taken it too long. We're no longer able to recover adequately, and instead of just going into those depths of training, going into the high fatigue amounts of training and tapering down, we stay there. So this is the difference between a functional overreach and a non-functional overreach. And in many times, you take a functional overreach, recovery from a functional overreach can take about a week, maybe 2 weeks tops. When it comes to a non-functional overreach, that extends even further. If you're a typical person, it takes a week to recover. It may take 2, it may take 3, it may take 4 weeks to recover from a non-functional overreach. Okay, practical stuff though, tangible stuff. How do we actually identify this? All right. When we're going through a peaking block, there's things that are difficult, right? We're tired. A lot of people will say they're beat up. A lot of people will see slight decreases in performance. But when we've seen this, not just for a session, but when we've seen this for a week or two, we've gone too far into the tank. When motivation to train has decreased to a point that it's very difficult to even get the work in, and all other things are normal, If motivation is normally pretty good with the sleep routine and the food and the normal basics are dialed in, then we have to start looking, are we in the zone of non-functional overreach? So Trevor, I hope that answers your question. There's always treading a line. With each athlete, you're gonna find where their recovery capabilities are and how long you can stay kind of in this zone. But for most people, it's gonna be a month to 3 weeks where you have this peaking block and are able to drive this level of fatigue that's gonna lead to supercompensation. Trying to extend that out is gonna be more difficult to actually do, and you run the risk of non-functional overtraining, which, by the way, I will say the biggest risk factors that I see for that with athletes are program hoppers. So ones that go from one program on the internet to another program on the internet to another program on the internet, and individuals who don't understand the peaking process, regardless of where they came from, whether that's DUP, whether that's linear, whether that's conjugate, it doesn't really matter. If they're coming in and they're not taking recovery as this dotted line as a very serious thing, then we can start to run into some of these issues. So catch you next time. Appreciate it.